The stakeholders would be the patients, nurses, and management. So the requirements for this project will be inpatient elderly adults. Nurses would have to be full-time employees and willing to implement new practices. Management will provide full support for the nursing staff. Some needs from the patients would be full compliance, as well as from the nurses will need full cooperation and the willingness to fully participate in individualizing the patient's plan of care with an individualized and fall risk assessment. Management would provide appropriate tools and support for an easy transition for the trial. Some attitudes and risks that the trial can face is patients' noncompliance, as well as nurses' lack of participation and incomplete individualized fall risk assessment. Management can have a lack of support, as well as not a smooth transition to the trial. Some actions that could be provided for the patient is education, reorienting the patient, providing the patient safety by placing non-invasive interventions that can be individualized for the patient's needs. For the nurses, they would be encouraging the staff to participate in the trial. The nursing staff would be implementing hourly rounding for the patients to reduce falls. They will be provided education to give confidence, as well as enhancing the communication within the healthcare professionals. And they will be individualizing and identifying all fall risk patients and providing skills checkoff annually. And then management will have an easy transition to full implementation of the new practice.